Welcome to this section of our multi-part mini-series on using laser-guided movements as an adjunct to neurorehabilitation through exploiting cerebellar properties. Let's dive right in, shall we? We know where our hands are in two ways. We can see them, and we can feel their position even with our eyes closed. That's proprioception. The brain doesn't just pick one of these signals, it blends them together into a single unified sense of where the hand is, then uses that combined estimate to guide movement. Now here's where it gets interesting. When people learn to move in a distorted environment, like pushing against an unexpected force, the cerebellum drives that learning process. And it turns out this kind of adaptation doesn't just change how you move, it also changes how you sense your hand's position. Sexton BM, Scientific Reports, July 2019. And push it out. I'm going to push to the side. So, okay, bring it back. Push it out.
That's okay.
Bring it
And I'll
back.
mark that in there, that's fine.
Push it out. Bring it back. Push it out. Okay, relax there a second. Close your eyes and picture that movement again. To begin force field motor adaptation, have the patient trace along the target pathway with a handheld laser. However, you can drive stronger cerebellar activation by adding a resistive force that tries to pull or push the arm off course. In practice, this is straightforward. You can simply press against the patient's arm as they move along the path or attach an elastic band that creates a constant force they have to work against throughout the movement. Using brain imaging, researchers uncovered something fascinating about how the normal brain responds to sound. When the brain is exposed to rhythmic auditory stimulation in the gamma frequency range, the electrical response measured on the scalp, the EEG, peaks sharply at 40 Hz, with weaker responses at both lower and higher frequencies. What made this finding even more striking was that 40 Hz didn't just produce the strongest scalp response. It also uniquely lit up a specific region of the cerebellum called the pontocerebellum, which plays an important role in timing and in regulating cortical activity. Other frequencies simply didn't do this. Pasteur, Journal of Neuroscience, 2002. We can exploit this therapeutically by using the Tone Pacer app. Keep on letting go. Okay, relax her a little bit. Purple stripe and the blue. In a previous video, we introduced post-it note targets, a head-mounted laser pointer, and the ocular gest. In this clip, our patient demonstrates a gest to the left, meaning leftward gaze normalizes motor control of his head and neck. We built the following exercise around that finding. Turning left, eyes lead, head follows. Starting center, the patient shifts his eyes to the left post-it, fixes his gaze, then rotates his head to align. He repeats this eye then head sequence target by target until reaching the end of the row. Returning right, head leads, eyes follow. The patient moves his head first, keeping his eyes fixed left to maintain the gest. The laser indicates his new head position, and he then shifts his eyes to match. He repeats this head then eye sequence back across the row, activating the gest with initial leftward gaze, then sustaining it during rightward head movement. Produces noticeably smoother, more controlled motion. The exercise design is straightforward. Simply identify the patient's gest direction and build the movement sequence around it. This technique is effective for dystonia, but only when an ocular gest is present. Your hip first. Double inverted pendulum head-pelvis relationship. Under the ankle strategy, head and pelvis move in phase, the body sways as a single unit, winter 1998. Under the hip strategy, the defining feature of the dip model, the segments move anti-phase, pelvis translates in one direction while the trunk and head counter-translate in the opposite direction, preserving the center of mass over the base of support, Suzuki 2012. This anti-phase intersegmental coordination is precisely what the dual laser exercise targets. Pelvic translation in one direction should drive a compensatory head translation in the opposite direction, visible in real time via the two lasers. Disrupted basal ganglia cerebellar timing degrades this coordination, causing in-phase or dysrhythmic compensatory responses rather than clean opposition. The Swiss ball permits the hip strategy to emerge while maintaining safety. Frontal plane dip mechanics engage hip abductors, adductors, adding complexity not fully captured in sagittal models, Pinter 2008. Direction. Now move your hip the other way. Get your balance. And move your shoulder. Now, so same thing, hip goes first. Your hip first. Get your balance. Move your shoulder the same direction. Now move your hip the other way. Get your balance. And move your shoulder. Now, so same thing, hip goes first. That concludes our discussion for today. I hope you found this information valuable for your clinical practice. Thank you for your attention, and I wish you continued success in your work with patients. I hope to see you again at a future lecture.